Pyogenic organisms affect human bones, hence causing a condition called osteomyelitis. This condition involves two stages: acute osteomyelitis and chronic osteomyelitis. Staphylococcus aureus, streptococci, and pneumococci, and typhoid bacilli are some of the microorganisms that cause this condition. These microorganisms can reach the bone via hematogenous spread or direct inoculation through an open fracture, common to bones like tibia, femur, and the humerus. When the microorganism enters the bone, it will induce an acute inflammatory reaction, hence forming pus. This is acute osteomyelitis. The patient will experience a fever, severe pain over the affected bone, and a warmer skin with redness. In case the condition is not treated at an acute stage, it will complicate into chronic osteomyelitis, where the pus that was formed during the acute stage finds way to the bone surface, forming a subperiosteal abscess. Blood supply is cut off by septic thrombosis, hence the affected bone part dies and separates from the main bone, forming a sclerostom. A new bone lays. This is called the involucrum. The patient will experience multiple sinus formation over the affected body part, severe pain, and a thickened bone. Usually during the acute stage of osteomyelitis, the X-ray shows no changes on the affected bone. However, the C-reactive protein and the erythrocyte sedimentation rate are raised. The X-ray will reveal a thickened bone with a honeycombed appearance and a sclerostom during the chronic stage of osteomyelitis. An MRI scan is also done to evaluate the damage to the soft tissues. Treatment of this condition differs according to the stage of the disease. For acute osteomyelitis, IV ceftriaxone is given for 4 weeks and IV fluoxetine is given for 2 weeks with rest and monitoring the prognosis of the disease. For chronic osteomyelitis, the sclerostom is removed by a surgeon and the bone is stabilized. An antibiotic cover may be given or not.